Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. Today, we're unpacking last week's CDC Vaccine Advisory Committee meeting, known as ACIP, and we'll also address President Trump's recent controversial remarks about Tylenol, autism, and vaccines. So let's get into it. Let's start with the ACIP meeting. The ACIP meeting was supposed to be routine, reviewing updates for COVID-19, hepatitis B, and the combination MMRV vaccine for kids. But as with much of vaccine policy these days, it was anything but routine. What we saw was confusion, misinformation, and politics colliding with science, and yet the outcome, at least for now, was a partial victory for patients. I'll explain. On Thursday, September 18th, the committee voted to remove the option of the MMRV combination vaccine. That is the single shot that protects against measles, mumps, rubella, and chickenpox for children under 4. This does not eliminate those vaccines, but it does eliminate the convenience of getting a single shot for children under 4. And this is especially an annoyance, if you will, or an inconvenience for families trying to limit doctor visits, which is essentially all of us. At the same time, the hepatitis B vaccine was on the agenda, but no vote was taken. That leaves newborn nurseries and parents in limbo, unsure what will happen next. Friday was the big one, COVID-19 vaccines. All signs before the meeting pointed to ACIP narrowing access, limiting recommendations only to older adults and people with certain risk factors, such as folks who are immunocompromised. But in the end, the committee recommended the COVID-19 vaccine for everyone 6 months and older in partnership with a clinician. That means doctors, and in some states even pharmacists, can continue to recommend and administer the vaccine broadly. Now, the discussion was filled with a lot of misinformation throughout the proceedings. More than 50 falsehoods by one count, including claims that DNA contamination leads to cancer risks, none of which is supported by evidence. But despite all that noise, the final vote went against the narrative going into the meeting. The science hasn't changed, but clearly the pressure has. Here's what I think may have happened. This decision did not happen in a vacuum. It happened because advocates, patients, medical groups, and even funders raised their voices. People pushed back against the idea of restricting access to vaccines. That pressure reached the White House and in turn pressured Health Secretary Robert F. Kennedy Jr. not to let ACIP go too far. So what does this mean? First and foremost, it shows that advocacy works. You might not always see it in the headlines, but behind the scenes, public pressure can change outcomes. Second, it is a reminder that the fight is not over. Hepatitis B and other vaccines are still on the table. And third, patients need clarity. Confusion about who is eligible and whether insurance will pay creates real barriers to care. So, with all that said, we got a nice weekend breather after Friday's chaos at ACIP. So what happened after the weekend? Well, on Monday, President Trump added some fuel to the public health fire with a White House press conference that evoked the chaos of the early COVID briefings. This time, he claimed that pregnant women should avoid Tylenol, or in the generic form, acetaminophen, because it is linked to autism, and he repeated debunked claims about vaccines. President Trump said that taking Tylenol while pregnant leads to, quote, very increased risk of autism, end quote. Despite decades of evidence that it is safe, Trump also suggested that women limit Tylenol use during pregnancy, quote, if you can tough it out, end quote. Here are the facts. Tylenol and autism. Some studies suggest a possible association between acetaminophen use during pregnancy and conditions like ADHD or autism, but no study to date has proven causation. Doctors say that Tylenol has important uses during pregnancy, like controlling for fever, which itself can cause harm to a nursing child. Vaccines and autism, we've spoken about this before, but dozens upon dozens upon dozens of studies over many decades show no connection between vaccines and autism. This claim has been thoroughly debunked. And hepatitis B. President Trump said kids shouldn't get the vaccine for hepatitis B until age 12 because it relates to a sexually transmitted disease. In reality, hepatitis B can spread during childbirth or through tiny amounts of blood, which is why doctors recommend it as early as possible. The FDA recently acknowledged that research into acetaminophen in pregnancy is ongoing, but their statement was quite measured. Well, that's it for today's episode of The Health Advocate. We'll keep tracking ACIP, the vaccine schedule, the potential links between Tylenol and autism, and what this all means for patients like you, because protecting access to vaccines is protecting lives. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.